Hi, good morning. Today we will discussing about endocrine system. Endocrine system, there is two type of glands are here, ductless gland and this ductless gland means known as exocrine gland. Exocrine glands are duct gland. They are called enzyme produced glands. The exocrine means duct gland. They have duct. They produce enzymes that into the duct, that this duct will be helped to move these enzymes to the blood. Exocrine is a gland, is a duct gland. They are called enzymes produced glands. Then endocrine gland. Endocrine gland is a ductless gland. Hormones produced direct into the blood. There is no duct is present in endocrine glands and it will be ductless and it directly hormone produced into our blood. Then type of glands are pituitary gland, pineal gland, that can be seen in head regional means seen hormone are pituitary and pineal gland. Then neck, there is thyroid gland, parathyroid gland, thymus gland. Then kidney, there is an adjacent adrenal gland is present. Then testis and ovary, testis in male and ovaries in females. In first we are discussing about the pituitary gland. Pituitary gland, it can be seen in our head. Mainly it is a known as master gland. It is a master gland. Why? It regulates all other glands. It is considered as our master gland. It regulates all another glands and it will be situated below the hypothalamus region. We already says that the pituitary gland, it can be seen in where it is seen our head and it can be mainly situation in the below the hypothalamus. Below the hypothalamus, it is only having 0.5 gram weight. Then pituitary gland again divided into two lobes. It is some books it will be divided into three and here we will discussing about mainly it divided into two lobes, that is anterior and posterior lobes. Anterior lobe, there is another name is adenohypophysis. Hormone produced from this adenohypophysis or anterior lobe is growth hormone, thyroid stimulating hormone, then adrenotropic hormone, then gonadotropins. Gonadotropin, there is FSH and LH, follicular stimulating hormone and luteinizing hormone, then melanocyte stimulating hormone. These all hormones that produce from our anterior lobe or adenohypophysis. Hormone produced, that is growth hormone, thyroid stimulating hormone, then adrenotropic hormone, gonadotropin, there is FSH, LH and melanocyte stimulating hormone. Then posterior lobe is known as neurohypophysis. Here we mainly say some books it divided into anterior lobe, middle lobe and posterior lobe. In middle mainly seen in melanocyte stimulating hormone. It is not much importance, but we will discussing as anterior hormones, melanocyte stimulating hormone. Then posterior lobe is also known as neurohypophysis. Hormone of posterior pituitary gland produced by hypothalamus. They produced only two hormones. In posterior lobe neurohypophysis, they only produces two hormones, that is antidiuretic hormone, that is vasopressin and oxytocin. Vasopressin and oxytocin is an only two hormone produced from our posterior pituitary. Then anterior pituitary we can produces which are the hormone? Growth hormone, then adrenotropic hormone, gonadotropic hormone, that it contain FSH, LH and melanocyte stimulating hormone from the middle lobe. Then again there is another hormone is thyroid stimulating hormone. Then anterior lobe growth hormone. Growth hormone function is it help in muscle strength and bone growth. Growth hormone secretion increase at children's and secretion decrease with aging. Growth hormone secretions increase at night. Excess growth hormone leads to hyperglycemia. Here, the growth hormone that is produced from the anterior lobe of the pituitary, its main function is growth hormone. That word means that help to growth. It help in muscle and bone growth. And growth hormone secretion increase at children. We know that children needs growth hormone because of their growth. That hormone will be help to growth of their muscles and their bones. And secretion decrease with aging. In after completing our 18 or 20 years, we will acquire much growth in our body. Then it will be secretions of this growth hormone become decreases, and growth hormones secretions increase at night. In some mainly we have to seen this growth hormone secretion that increases mainly at night time. Then excess growth hormone leads to hyperglycemia. Excess growth hormone that leads to hyperglycemia. It is a stress hormone. It is also a stress hormone. These all are the functions that can be seen in growth hormone. Some diseases has occurred due to their excess secretions and deficiency that causes some disease. We can explain another about that disease caused by the growth hormone inappropriate production. That is disease condition of the growth hormone is excess growth hormones in children leads to gigantism. There is a disease, it is very important, that is gigantism because of excess growth hormones in children, and excess in adult leads to acromegaly. Excess in adult leads to acromegaly. Then deficiency of growth hormones in children that leads to dwarfism. But in our adult there is we also says that the growth hormone will be secretion will decreases during adult time. So its deficiency is not cause much problems in adult. In acromegaly we can be enlarged jaws, malocclused teeth, enlarged hands and feet, and prominent supraorbit and large nose. This all seen in this acromegaly stage. Enlarged jaws. Excess secretions of the growth hormones in adults leads to acromegaly, and excess growth hormone in children leads to gigantism. Then acromegaly is an enlarged jaws, malocclused teeth, enlarged hands and feet, and prominent supraorbital and large nose are seen. Surgical management is hypophosphatectomy. Its surgical management mainly discusses hypophosphatectomy, that is removal of the pituitary gland, that is hypophosphatectomy, or anterior lobe, pituitary gland or anterior lobe removal. This is about the growth hormone and its a deficiency or excess secretions that causes these problems.